Hello, I'm Dr. Fox. Today, I'd like to talk about morning sickness, nausea, and vomiting of pregnancy. So first of all, what is morning sickness? So morning sickness is also called nausea and vomiting of pregnancy or NVP and means you feel sick in your stomach and vomit. Even though it's called morning sickness, it can last all day and happen at any time of day. So do all pregnant women have morning sickness? My answer is not all, but most. At least 70% have morning sickness in the first trimester, first 3 months of pregnancy. For the majority, it starts at about 6 weeks of pregnancy, is worst at about 9 weeks, and finishes in the second trimester from 14 weeks. A very few women have it throughout their pregnancy. Next, is morning sickness dangerous? In most cases, no. Most women have mild NVP, which means they feel nauseated for a short time each day and may vomit once or twice. However, others can have severe NVP, which means they feel nauseated several hours each day and vomit several times. The most severe case is a condition called hyperemesis gravidarum, which only affects about 3% of pregnant women. You may have hyperemesis gravidarum if you have lost 5% of your pre-pregnancy weight and are dehydrated. If you do, you will need treatment and sometimes hospitalization. If you think you might have this condition, or if you still have morning sickness in the first month of pregnancy, tell your healthcare provider straight away. Okay, next question. Can you carry on as normal if you have morning sickness? So my answer is, it depends how severe it is. You may find it has a serious effect on your daily life and you may be unable to work or follow your normal daily routine. Next, are some women more at risk of severe NVP? My answer is yes. There are some risk factors. You are more likely to experience NVP if you have a multiple pregnancy, a history of NVP, travel sickness, or migraines, your mother or sister had severe NVP, or you're expecting a baby girl. Okay, next. Is morning sickness the only cause of NVP? It is possible that you experience nausea and vomiting while you are pregnant for other reasons. For example, you may have an ulcer, food-related illness, or thyroid or gallbladder disease. If you have some conditions at the same time as NVP, you should tell your doctor so they can check. Firstly, tell your doctor if the NVP starts later than 9 weeks of pregnancy. Secondly, if you also have abdominal pain or tenderness. Thirdly, if you also had a fever or headache. And lastly, if the thyroid gland is enlarged. There is a swelling at the front of your neck. Okay, next. Can NVP affect your baby? My answer is not usually. However, if it is so severe that you start losing weight because you cannot keep food and drink down, it can affect the baby's weight at birth. Okay, next. Can NVP be treated? You can try making changes to your diet and lifestyle. Some women find taking a multivitamin pill or eating or drinking anything with ginger, tea, ale, sweets, etc. helps. Others eat dry toast or crackers first thing in the morning before getting up. Also try drinking fluids so often so you do not get dehydrated and eat lots of small meals instead of 3 large ones. Bland foods are less likely to trigger nausea, such as the blood diet, including bananas, rice, applesauce, toast, and tea, and you may find you are particularly sensitive to certain smells. be aware that frequent vomiting can damage your teeth enamel, so if your NVP is severe, you could try rinsing your mouth with a teaspoon of baking soda dissolved in a cup of water to neutralize the acid from your stomach and protect your teeth. If none of these lifestyle changes works, you can try over-the-counter remedies. Most women try vitamin B6 first, followed by doxylamine if necessary. A drug exists that combines both these in one, but you have to get it on prescription. Both vitamin B6 and doxylamine are safe for your baby. The next step in medical treatment, if vitamin B6 and doxylamine do not work, is antiemetic drugs to prevent vomiting. Your doctor will tell you which is safe to use during pregnancy. A severe NVP can cause health problems if you are worried that you're developing hyperemesis gravidarum. You should tell your doctor so that they can intervene. You may have to go into hospital for a while so doctors can check on your health and if necessary, rehydrate you through a drop. Okay, thank you for watching. See you soon.